Imagine this for a moment. You have successfully navigated the transition of menopause. You have celebrated a full and complete year without the inconvenience of periods. And you have finally begun to enjoy the profound and wonderful freedom from the cycle of monthly bleeding. Life, in many ways, feels calmer. You no longer have to remember to pack pads in your purse or worry about the possibility of staining your clothes. But then, one morning, you notice an unexpected spot of blood on your underwear. It may be just a light, faint stain, but your heart understandably skips a beat. You might find yourself asking, is this normal? Could it just be a result of stress, recent exercise, or maybe even something I ate? The fundamental truth is that after you have gone through menopause, any bleeding is a red flag that demands your attention. While it is true that not every cause of postmenopausal bleeding is life-threatening, a consensus of medical experts, including those from the esteemed Mayo Clinic and the National Cancer Institute, unequivocally emphasize that this symptom should never, under any circumstances, be ignored. It is your body's intelligent and often urgent way of signaling that something deeper may be happening within. And paying close attention to this signal in its earliest stages could be the very thing that protects your long-term health, and in some cases, could even save your life. Hello, I am Dr. Lily Stone. For more than 3 decades, I have had the immense privilege of walking alongside women just like you, helping them to navigate every single stage of their lives, from the unpredictable and often confusing changes of perimenopause to the quieter and more reflective years that follow menopause. Over those many decades, I have seen far too many women delay the crucial step of talking to their doctors because they mistakenly assumed that a little bleeding after menopause was just a normal part of the aging process. Some have waited for weeks, for months, and even for years, only to later learn that the bleeding they had dismissed was, in fact, linked to something as serious as uterine cancer. My mission today is to help you to avoid that same dangerous and heartbreaking delay. In today's comprehensive video, we are going to uncover the essential truths about post-menopausal bleeding, why it happens, when you should be concerned, and what specific steps you can take to protect yourself. I will share with you real patient stories, critical medical facts that are backed by trusted sources like the American College of Obstetricians and Gynecologists, a COG, and clear, actionable next steps that you can follow if you ever find yourself facing this particular situation. Before we dive deeper into this important topic, I want to personally and warmly invite you to subscribe to this channel, Eldervare Wellness, where we are committed to bringing you compassionate, evidence-based advice that is designed especially for women over the age of 50. Every single week, we share practical guidance that is intended to empower you to take confident charge of your health, your body, and your future. If you have ever experienced any kind of unexpected bleeding, or if you have a close friend or a sister who has, I strongly encourage you to comment below and to share your story. Your voice truly and deeply matters. When women begin to speak openly and honestly about symptoms like this, it works to break the pervasive and dangerous silence, and it helps other women to realize that they are not alone in their experiences. Sometimes, a single shared experience in the comments section is the very thing that inspires another woman to make that crucial call to her doctor sooner rather than later. Together, we can create a powerful and supportive community where knowledge, encouragement, and health all go hand in hand. So, please, hit that subscribe button and become a part of this growing and empowering circle of strength. Now, let us begin with the single most important and non-negotiable fact. Bleeding after the onset of menopause is never, under any circumstances, considered to be normal. By its strict medical definition, menopause means that you have gone for 12 consecutive months without having a menstrual period. That significant and important milestone is a signal that your ovaries have effectively stopped releasing eggs and have ceased producing the same high levels of estrogen and progesterone that once worked to trigger your monthly bleeding. From that point forward in your life, your reproductive system is, in essence, in a state of rest. So, if blood suddenly shows up again, whether it is a faint pink streak, some light spotting, or a flow of bleeding that resembles a period, It is not your body simply returning to business as usual. Instead, you must view it as an important and urgent warning flag. According to the Mayo Clinic, even the very smallest and most seemingly insignificant amount of post-menopausal bleeding requires a thorough and professional medical evaluation. Ignoring it is akin to seeing a plume of smoke rising in your kitchen and making the dangerous assumption that there is no fire. Most of the time, there may indeed be a completely harmless explanation, but until a doctor has had the opportunity to investigate, you will not be able to know for sure. Of course, it is important to state that not every single cause of post-menopausal bleeding is cancer. Sometimes, the reasons behind it are much more benign, but they are still very important to diagnose and to treat. For example, a great many women will develop a condition that is known as vaginal atrophy, which is also sometimes referred to as atrophic vaginitis. This occurs when the lower levels of estrogen that are present after menopause cause the delicate walls of the vagina to become thinner, drier, and significantly more fragile. Even very gentle and routine activities, such as walking, exercising, or being intimate with a partner, can sometimes cause tiny and microscopic tears in the tissue that can lead to some light bleeding or to spotting. Another very common reason for this is the growth of polyps, which are small and usually non-cancerous tissue growths that can develop on the cervix or inside the uterus. These growths can often cause some irregular bleeding or spotting, especially after the act of intercourse. Certain types of medications, such as blood thinners, can also be a factor that can make any kind of a bleeding more likely to occur. While these particular causes may not sound especially alarming, they still absolutely deserve your attention because they can have a significant and a negative impact on your comfort, on your relationships, and on your overall peace of mind. The key and most important takeaway from all of this is a simple one. Only a qualified doctor can be able to determine whether the bleeding that you are experiencing is a harmless and a benign issue, or if it is a sign of something that is much more serious. But here is where we need to pause and to take a very serious look at the situation. In some cases, the experience of a post-menopausal bleeding is the very earliest and sometimes the only symptom of a condition like endometrial cancer, which is a cancer of the uterus. According to the esteemed American Cancer Society, about 9 out of every 10 women who are diagnosed with endometrial cancer have experienced some form of a bleeding after their menopause as their very first and their most important warning sign. That means that this particular and this important symptom is not one that you should ever be able to dismiss or to delay in addressing. The act of an early and a timely detection is able to make a life-changing and a life-saving difference. When it is found in its very early stages, endometrial cancer is a highly and a very treatable form of a cancer, with the survival rates being so much higher than when it is diagnosed in its later stages. And it is not just the cancer itself that we need to be concerned about. There are other and more dangerous conditions, such as endometrial hyperplasia, which is an abnormal and a precancerous thickening of the uterine lining. That can also be a trigger for a bleeding, and that may eventually be able to lead to a malignancy if it is left untreated. This is the very reason why all of the doctors will so strongly and so consistently emphasize that even if the bleeding that you are experiencing seems to be so very light or so very temporary, your safest and your most prudent choice is always to be able to schedule a medical and a professional evaluation as promptly as you possibly can. So, let us now recap this first and this key and this important point all together. Any kind of a bleeding that you may experience after your menopause is not normal. And it is always and completely worth it for you to have a conversation with your doctor about it. Sometimes, the cause of this can be a very mild and a very treatable one, such as a dryness or a polyp. But at other times, it may be an early and a red flag for something that is so much more dangerous, such as a cancer. In the next part of this video, we will be diving so much deeper into the specific and the various medical evaluations that your doctor may be able to recommend for you, such as an ultrasound, a biopsy, and a variety of other exams, so that you will be able to know exactly what it is that you should be able to expect and so that you will not have to feel as if you have been left in the dark. Please remember, the act of our knowledge is a form of a power. The more that you are able to understand what is happening inside of your own and your personal body, the less that the feelings of a fear and of an uncertainty will be able to hold you back. Please stay with me, because by the end of this series, you will not only be able to know why a post-menopausal bleeding is so dangerous, but you will also be able to know how to be able to take some confident and some proactive steps towards the act of protecting your own and your personal health and your own and your personal future. When you first experience any kind of a bleeding after your menopause, and you are able to schedule an appointment with your doctor will be able to begin the process with a detailed and a comprehensive medical history. They will be able to ask you about when the bleeding had first started, about how much of a blood you have been able to notice, and about whether it had been a one-time and an isolated event, or if it has happened more than once. They may also be able to ask you about any of the medications that you are currently taking, especially a hormone therapy or a blood thinner, as these can sometimes be a factor that is able to influence a bleeding. It is so very natural and so very normal for you to be able to feel so nervous when these particular and these important questions are able to come up. But it is so very important for you to be able to remember that your doctor is not just simply and vaguely collecting a series of information. Each and every one of these details is able to be instrumental in helping them to be able to narrow down the various and the sundry possible causes. You can think of it as being like a detective who is so carefully and so precisely piecing together all of the clues. The more openly and the more honestly that you are able to share, the faster that they will be able to get to the truth and to be able to guide you towards the right and the proper solution. After your history has been taken, a pelvic and a professional exam is usually the very first and the most important step. This is a physical and a professional check that is able to allow your gynecologist to be able to examine your cervix, your vagina, and your uterus. A great many of the women that I have worked with over the years will so often worry that the exam will be an uncomfortable one, but it is generally a very quick and a very straightforward one. During this particular and this important check, your doctor will be able to look for any of the visible and the apparent causes of a bleeding, such as a polyp, an irritation, or any of the signs of a thinning of the tissue. They may also be able to check your abdomen in order to be able to feel the size and the shape of your uterus. While it can certainly be able to feel a bit awkward, it is so very important for you to be able to try to remember that this is simply and completely a medical and a professional process that has been so carefully and so precisely designed to be able to protect your own and your personal health. Just as you would never have to skip a heart and a professional checkup if you were to have a chest pain, this particular and this important exam is your body's own and its intelligent way of being able to ask for some attention. Depending on what it is that your doctor is able to see, they may be able to recommend an ultrasound, which is so often performed with a small and a gentle probe that is inserted into the vagina. This particular and this important procedure is known as a transvaginal ultrasound, and it is able to give a very clear and a very comprehensive picture of your uterus and of the thickness of your endometrial lining. In the women who are in the post-menopausal stage of their lives, having a thin and a slender uterine lining is generally a very reassuring and a very positive sign, while having a thicker and a more substantial lining may be a factor that is able to raise a concern for a variety of conditions, such as an endometrial hyperplasia or a cancer. The wonderfully and the profoundly good news in all of this is that the ultrasound is a very painless and a very safe procedure. It is like you are shining a flashlight inside of your own and your personal body, a factor that is able to give your doctor some valuable and some important insight without you having to undergo any kind of a surgery or of a discomfort. If you have ever had an ultrasound during a pregnancy, or for any other kind of a reason, you will be able to find that the process is a very familiar and a not at all an intimidating one. Sometimes, The act of an imaging alone is not enough to be able to give us all of the answers that we are looking for. If the ultrasound is able to suggest any kind of an abnormality, your doctor may be able to order an endometrial biopsy. This particular and this important procedure is able to mean that a small and a seemingly insignificant sample of a tissue will have to be gently and carefully removed from the lining of your uterus so that it can be able to be studied under a microscope. A great many of the women that I have worked with over the years will so often worry about the experience of a pain during this particular and this important procedure. But the vast majority of them will so often describe it as being just a brief and a fleeting state of a cramping that is able to pass so very quickly, and that is so very similar to the experience of a menstrual cramp. And while it is certainly true that the very idea of a biopsy can so often sound so very scary, it is so often the most powerful and the most effective of all of the tools for being able to find the truth. If there are any of the cancerous or of the precancerous cells that are present, this particular and this important test will so often be able to find them. According to the esteemed American Cancer Society, the act of our detecting these particular and these important changes in their very early stages is able to dramatically and profoundly improve our outcomes, a factor that is the very reason why all of the doctors will so often recommend it, even for the smallest and the most seemingly insignificant of all of the amounts of an unexplained and an unexpected bleeding. For some of the women that I have worked with over the years, a variety of additional and of more comprehensive procedures may be necessary, such as a hysteroscopy, a procedure in which a tiny and a slender camera is used to be able to look directly and precisely inside of the uterus. This particular and this important procedure is able to allow the doctors to be able to see a variety of polyps, of a fibroids, or of any other kind of a growths that may not be able to appear so clearly on an imaging study. Sometimes a dilation and a curettage, which is so often and so commonly called a D&C, is performed, a procedure in which the tissue is gently and carefully scraped from the lining of the uterus for a further and a more comprehensive testing. While these particular and these important procedures may so often sound so much more invasive, they are usually just an outpatient procedure, which simply means that you are able to go home on the very same and the very exact day. And most importantly of all, they are able to be a factor that is able to provide a great deal of a clarity and of a peace of a mind by either being able to rule out or to be able to confirm a variety of serious conditions. The act of our having to know what is going on is able to give you the power to be able to act. Instead of your having to stay trapped in a state of an uncertainty, it is also very much worth it for me to be able to mention that not all of the evaluations are able to lead to an alarming and a scary news. In fact, a very large and a very significant percentage of all of the women who are able to undergo a testing for a postmenopausal bleeding are able to discover that the cause of their condition is a benign and a harmless one. That might be a variety of tissue changes that are due to a low level of an estrogen, a variety of small and a non-cancerous growths, or even an irritation that is being caused by a variety of medications. But here is the key and the most important point of all of this. You are only able to know that it is a benign and a harmless condition after the tests have been able to confirm it. I can once remember having to care for a woman who was in her late 50s and who had had to delay her doctor's visit for nearly a full and a long year, as she had been so very convinced that her bleeding was just a simple and an insignificant matter of a dryness. When she had finally been able to come in to see me, her ultrasound and her biopsy had been able to reveal that she had only a small and a seemingly insignificant polyp, which had been able to be removed in just a matter of minutes. She had later had to say to me, "I so wish that I had not lost so much of a sleep all of those months. If I had just been able to come in right away, I would have been able to save myself so much of a worry." The various and the sundry evaluations may so often be able to feel so very intimidating, but it is so very important for you to be able to try to see them as being a series of stepping stones towards a state of a safety. each and every one of these tests is able to provide so much more of a clarity, as it is able to peel back the various and the sundry layers of an uncertainty until the truth is finally able to be revealed. And the sooner that you are able to start this particular and this important process, the sooner that you will be able to either find a sense of a peace of a mind, or if there is something so much more serious that is present, to be able to begin a treatment at a stage when the outcomes are so much more better. In the next part of this video, we will be taking a closer and a more detailed look at the range of the conditions that are able to cause a post-menopausal bleeding, from the most common and the most benign of all of the issues to the rare but so much more dangerous of all of the ones, so that you will be able to understand exactly what it is that the doctors are looking for and why an early and a timely detection is able to matter so very much when it comes to the act of our having to understand a post-menopausal bleeding. It is so very helpful for us to be able to think of the causes as being on a spectrum, from the relatively and the harmless to the more concerning. On one end of this particular and this important spectrum are a variety of conditions that are so very common and that are so very treatable. And on the other end of this particular and this important spectrum are those that can be so very dangerous if they are left unchecked. The act of our having to know this particular and this important spectrum is not only able to reassure you when the cause of your condition is a benign and a harmless one, but it is also able to empower you to be able to act so much more quickly if it is not. Let us start with the more common and the less serious of all of the reasons first. One of the most frequent and the most common of all of the causes is a vaginal atrophy, which is so often and so commonly called the genitourinary syndrome of a menopause. This particular and this important condition is known to happen when the lower levels of our estrogen are able to thin and to dry the tissues of our vagina and of our urinary tract. The tissue is able to become so very fragile, just like a delicate and a precious paper. So even the lightest and the most seemingly insignificant of all of the friction during an intimacy or of an exercise can so often be a factor that is able to cause some spotting. A great many of the women that I have worked with over the years are so very surprised to be able to learn that even something as simple as a long and a brisk walk or a bicycle ride can be a factor that is able to trigger a bleeding. Fortunately, the treatment for this particular and this important condition is so often a very simple and a very straightforward one. A variety of moisturizers, of a lubricants, or of a low dose of a vaginal estrogen that is being prescribed under a doctor's guidance can be a factor that is able to restore a sense of a comfort and to be able to reduce a bleeding. According to the esteemed North American Menopause Society, these particular and these important treatments are so very safe for a great many of the women that I have worked with over the years, and they are able to significantly and dramatically improve their quality of a life. Another of the benign and the harmless of all of the causes is a polyp, which is a small and a seemingly insignificant growth that is able to develop on the cervix or inside of the uterus. You can think of them as being like a little and a seemingly insignificant skin tag in the reproductive tract. They are usually not cancerous, but they can so often be a factor that is able to cause some irregular and some unexpected bleeding, some spotting after a sex, or a heavier and a more substantial discharge. The act of our having to remove a polyp is so often a very simple and a very straightforward one, as it is so often performed in a doctor's office or in an outpatient clinic, and it is so often able to bring a very quick and a very welcome sense of a relief. A variety of fibroids, which are a benign and a harmless muscle tumor of the uterus, are so much less common in the years after the onset of our menopause, but they can occasionally be a factor that is able to cause a bleeding as well. While it is certainly true that the very word of a tumor can so often sound so very frightening, the vast majority of all of the fibroids are so very harmless, and a great many of them will so often be able to shrink in a natural and a beautiful way in the years after the onset of our menopause. Still, they are able to deserve our attention when a variety of symptoms are able to occur. On the more concerning and the more serious side of the spectrum is an endometrial hyperplasia. This particular and this important condition is known to happen when the lining of the uterus is able to grow so very thick, a change that is so often due to an imbalance of our hormones. The condition of a hyperplasia itself is not a cancer, but in some and in certain cases, it can be a factor that is able to progress to an endometrial cancer if it is left untreated. The various and the sundry symptoms of this particular and this important condition will so often include an irregular or of a heavy and a substantial bleeding, even in the years after the onset of our menopause. The wonderfully and the profoundly good news in all of this is that when this particular and this important condition is able to be caught in its very early stages, a hyperplasia can so often be able to be managed with a variety of medications, such as a progesterone therapy, or with a variety of minor and of seemingly insignificant procedures to be able to remove the abnormal and the unwanted tissue. This is the very reason why all of the doctors will so often recommend an evaluation as soon as a bleeding is able to start, because an early and a timely intervention can so often be a factor that is able to stop the process before it is able to become so much more serious. And then there is the cancer of the endometrium, the most serious and the most concerning of all of the issues when it is able to come to a postmenopausal bleeding. According to the esteemed American Cancer Society, about 90% of all of the women who are diagnosed with this particular and this important cancer have been able to experience a bleeding after their menopause. That particular and that important fact is able to make it the single and the most important and the most critical of all of the symptoms for us to not ever have to ignore. The wonderfully and the profoundly encouraging part of all of this is that the cancer of the endometrium, when it is able to be diagnosed in its very early stages, is so often a very highly and a very treatable form of a cancer, with the survival rates being so very well above an 80%. The various and the sundry treatments may be able to include a surgery, a radiation, or a medication, depending on the stage of the disease, but the outcomes are so much more better when it is able to be found in its very early stages. This is the very reason why all of the doctors will so often emphasize that even just a little and a seemingly insignificant spotting is able to matter. It can so often be your very first and your only and your most important and your most critical warning sign. There are also a variety of less common, but still so very important of all of the causes, such as a certain and a specific infection, a trauma to the tissues of the vagina, or a variety of side effects of a variety of medications, such as a hormone therapy or a blood thinner. In some and in certain rare cases, a cancer of the cervix of the ovaries or of the vagina may be able to be discovered through the symptom of a bleeding. While it is certainly true that these particular and these important causes are so much less frequent, they are able to highlight the very reason why no and completely no post-menopausal bleeding should ever be dismissed. Every single and individual possibility is able to need to be so very carefully and so very precisely checked so that nothing is ever able to be overlooked. I can once remember having to care for a woman who was in her early 60s and who had been able to notice a streak of a blood after her morning and her regular walk. She had been able to assume that it was just from an overexertion, and she had been able to ignore it. When the bleeding had been able to return just a few and a simple and a short months later, she had finally been able to come in to see me. A series of tests had been able to reveal that she had an endometrial cancer, but thankfully, it had been at a very early and a very treatable stage. She had had to undergo a treatment, and she is now living a full and a healthy and a vibrant life. She had later had to say to me, "I so wish that I had been able to come in at the very first and the very earliest sign. I would have been able to save myself so many months of a worry." Her story is a very powerful and a very poignant reminder to all of us that our bodies are able to whisper before they are able to shout. The act of our having to listen to them in their very early stages is able to give us the very best and the most optimal chance for a health and for a peace of a mind. As you can now so clearly and so easily see, a postmenopausal bleeding is able to have so many of the possible causes, from a dryness and from a polyp to a hyperplasia and to a cancer. Each and every one of these particular and these important causes is able to deserve a proper and a professional evaluation. In the next part of this video, we will be focusing on what it is that you can do if you are able to experience this particular and this important symptom, on how you can be able to prepare for your doctor's visit, on what are the questions that you should be able to ask, and on the various and the sundry lifestyle steps that you are able to take in order to be able to support your overall and your comprehensive health, both during and in the years after your menopause. When you are able to notice a post-menopausal bleeding and you are able to prepare to see your doctor, it is so very helpful for you to be able to take a few and a simple and a straightforward steps that are able to make the appointment so much smoother and so much more effective. It is so very important for you to be able to start by being able to write down exactly when the bleeding had begun, how long it had been able to last, and what it had been able to look like. Was it a light and a seemingly insignificant spotting, a pink and a faint tinge, or something that was so much more heavier and so much more substantial? It is so very important for you to be able to note any of the activities that had seemed to be related to it, such as an exercise, an intimacy, or the act of your having to start a new and an unfamiliar medication. The act of your having to bring this particular and this important information with you is able to be a factor that is able to give your doctor a much clearer and a much more comprehensive picture. And it is able to be a factor that is able to ensure that nothing that is so very important is ever able to get overlooked. You can think of it as being like the act of your having to create a roadmap that is able to be instrumental in helping your physician to be able to find the fastest and the most efficient route to the answers that you are looking for. It is also so very wise for you to be able to make a list of all of your current and of your regular medications and of your supplements. Even the various and the sundry over the counter and the seemingly insignificant pain relievers, the various and the sundry herbal and the natural remedies, or the various and the sundry vitamins can so often be a factor that is able to affect a bleeding. It is so very important for you to be able to include any of the hormone therapies, if you are on them, as these can so often be a factor that is able to play a very important and a very significant role in the various and the sundry changes that are able to occur to your uterine lining. A great many of the women that I have worked with over the years are so very surprised to be able to learn that even a simple and a seemingly insignificant aspirin or a fish oil may be a factor that is able to thin their blood enough to be able to cause a spotting. By being able to share the full and the comprehensive list with your doctor, you are able to give them a complete and a comprehensive toolkit to be able to understand the situation. During your visit, it is so very important for you to not ever be afraid to be able to ask any of the questions that you may have. For example, you might be able to ask, what are the tests that you are able to recommend for me? And why are you able to recommend them? Or if my ultrasound or my biopsy is able to be a normal one, what else could be able to explain the bleeding? The more that you are able to understand, the less that the frightening the process is able to feel for you. Some of the women that I have worked with over the years are able to find that it is so very helpful for them to be able to bring a trusted and a beloved friend or a family member with them to the appointment, someone who is able to take some notes for them, or who is simply and completely able to provide them with some emotional and some moral support. It is so very important for you to be able to remember that you are not just a patient. You are, in fact, the most important and the most critical of all of the voices in your own and in your personal healthcare team. Beyond the various and the sundry medical and of the professional testing, there are a variety of lifestyle steps that are able to work to support your overall and your comprehensive reproductive and your general health. The act of our having to maintain a healthy and a stable weight, for instance, is able to work to lower our risk of developing an endometrial cancer, as an excess of a body fat can be a factor that is able to increase our exposure to an estrogen in our bodies, even in the years after the onset of our menopause. The act of our having to engage in a regular and a consistent physical activity, whether it is a brisk and an invigorating walk, a yoga, or a swimming, is able to work to support our circulation, to be able to reduce our inflammation, and to be able to improve our sense of our well-being. The act of our having to eat a diet that is so very rich in a variety of vegetables, of a whole grains, and of a lean and of a healthy proteins is able to be instrumental in helping us to be able to stabilize our hormones and to be able to strengthen our immune system. These particular and these important habits are not able to be a replacement for a medical and a professional evaluation, but they are able to be a factor that is able to create a strong and a reliable foundation for a healing and for a prevention. It is so very natural and so very normal for you to be able to feel so very anxious while you are waiting for your test results or for the answers from your doctor. A great many of the women that I have worked with over the years have told me that the hardest part of all of this is not the biopsy or the ultrasound. It is, in fact, the waiting. During these particular and these important times, I would like to encourage you to be able to lean on a variety of healthy and of a supportive coping strategies. The act of a gentle and of a deep breathing exercise, of a meditation, of a journaling, or even of a daily and a regular walk outside can be a factor that is able to calm your nervous system. The act of our having to share our fears with a friend, with a support group, or even in the comment section of this particular and this important channel can be a factor that is able to lighten the burden. The profound and the beautiful truth of the matter is that our fear is able to grow in a state of a silence, but it is able to shrink when it is able to be spoken aloud. Sometimes, a postmenopausal bleeding can be a factor that is able to bring up a variety of old and of forgotten memories, perhaps of your very first and of your very earliest period of your pregnancies, or of any other kind of a milestone in your reproductive journey. It can so often be able to feel as if your body is speaking a language that you had thought that you had left so far behind you. That is the very reason why it is so very important for us to not just simply and vaguely treat the symptom, but also to be able to care for our emotional and our mental health as well. It is so very important for you to be able to remind yourself that the act of your having to notice this particular and this important bleeding, of your having to take it so very seriously, and of your having to seek some answers for yourself is an act of a courage. It is you who is choosing to be able to honor your body's own and its intelligent signals and to be able to protect your own and your personal future. As we now begin to move into the final part of this series together, we will be able to bring everything that we have discussed together. We will be able to summarize the key and the most important of all of the points, to be able to reflect on the most important and the most critical of all of the lessons, and to be able to talk about what it is that it is able to mean for us to be able to approach a post-menopausal health with both a sense of a vigilance and of a hope. You will be able to leave with a clear and a comprehensive roadmap, not just for the act of your having to respond to a bleeding, but also for the act of your having to build a confident and a proactive relationship with your own and your personal body in the many and the wonderful years that lie ahead of you. We have now been able to travel together through a very important and a very critical conversation about a post-menopausal bleeding, and it is now time for us to be able to bring everything that we have discussed together. If there is one and a single and an individual message that I would like you to be able to hold on to, it is this one. The experience of a bleeding after your menopause is never and completely a normal one, and it is always and completely a factor that is able to deserve a medical and a professional attention. Sometimes, the cause of this may be a very simple and a very treatable one, such as a dryness, a thinning of the tissues, or a small and a benign growth. And at other times, it may be the very earliest and the most important and the most critical warning sign of something that is so much more serious, such as an endometrial cancer. Either way, your body is giving you some valuable and some important information and the act of your having to respond to it so very quickly is the very best and the most optimal way for you to be able to protect your own and your personal health. We have had the wonderful and the profound opportunity to be able to talk about the way in which the doctors are able to evaluate this particular and this important symptom through a variety of exams, of an ultrasound, of a biopsy, and sometimes of a variety of minor and of seemingly insignificant procedures. These particular and these important tools are not in any way meant to be able to frighten you, but they are meant to be able to give you some answers and some clarity. It is so very important for you to be able to remember that a great many of the women who are able to go through these particular and these important evaluations are able to discover that they have a harmless and a benign cause. But even in those particular and those important cases, the sense of a peace of a mind is so very invaluable. And if there is something so much more serious that is able to be discovered, an early and a timely detection is so often able to make the treatment so much more simpler and so much more successful. We have also had the wonderful and the profound opportunity to be able to explore the wide and the diverse spectrum of all of the possible causes. A vaginal atrophy, a polyp, and a variety of medication side effects are all very common and very treatable explanations that can so often be able to be managed with the right and the proper sense of a care. On the other side of the spectrum, an endometrial hyperplasia and a cancer are so much less common, but they are so much more urgent for us to be able to address. The key and the most important takeaway from all of this is that you are not able to know the cause of your condition until you are able to be evaluated. And the act of your having to guess on your own can so often be a factor that is able to delay the very help that you are so very much in need of. Throughout this particular and this important journey, I have also been able to encourage you to be able to view your own and your personal health as being a partnership. The act of our having to prepare for our doctor's visit, of our having to ask some clear and some specific questions, and of our having to maintain a healthy and a supportive lifestyle are all able to play some very important and some very significant roles in our prevention and in our recovery, by being able to make some choices that are able to work to support our bodies, like our having to stay so very active, our having to eat some nourishing and some delicious foods, and our having to care for our emotional and our mental well-being. You are able to give yourself the very best and the most optimal chance of being able to move through this particular and this important chapter of your life with a sense of a strength and of a confidence. As women, we are so often able to prioritize everyone else's needs before our own. I have had the wonderful and the profound opportunity to meet so many of the patients who have told me, I did not want to have to bother anyone, or I had thought that it was just nothing. But your health is never a bother. Your life, your comfort, and your peace of a mind are all so very much worth it for you to be able to protect. The act of our having to take a symptom like a postmenopausal bleeding so very seriously is not an overreaction. It is, in fact, an act of a self-respect. So, let me now leave you with this one, an important reflection. Your body is able to speak in a series of whispers before it is able to shout. That tiny and that seemingly insignificant spot of a blood may be your body's whisper, as it is asking you to be able to pause and to be able to pay an attention. By being able to listen to it, you are able to give yourself the precious and the beautiful gift of a time for a reassurance, a time for an early and a timely treatment, and a time for more and for many healthy and for many vibrant years ahead of you. Thank you so very much for having spent this valuable and this important time with me. If this particular and this important video has been able to help you, I would be so very grateful if you would please share it with another woman who might be in need of this particular and this important information. Please leave a comment if you have had any kind of an experience with a post-menopausal bleeding. Your story could be able to guide and to be able to comfort someone else. And if you have not yet done so, I would be so very grateful if you would please subscribe to Elderwear Wellness so that we can be able to continue this particular and this important journey together. Please remember, you are not alone. And the act of our knowledge is one of the most powerful and the most effective of all of the tools that you are able to have to be able to care for yourself.